You can't focus. You lose your keys every day. You start 10 things and finish none of them. So you Google your symptoms and everything points to ADHD. But what if it's not? What if the thing you've been calling ADHD is actually something else entirely, and treating it wrong is making everything worse? About 25% of adults think they have ADHD, but only around 6% actually do. That means for every person who truly has it, 3 or 4 people are convinced they do when something else is going on. And on the flip side, millions who generally have ADHD have spent years being told it's just anxiety, just depression, or just laziness. This video is for both of you. Whether you think you have ADHD and haven't been diagnosed, or you've been diagnosed and treatment isn't working, by the end you'll know exactly which conditions mimic ADHD, which medical problems your doctor should have tested for, and what a real evaluation looks like versus a bad one. And I need to warn you, what I'm about to show you in section 3 is something most providers completely skip. So stay with me. I'm Dr. Zaid Fadul, board certified in family medicine and addiction medicine, Harvard trained, flight surgeon in the U.S. Air Force Reserve, and CEO of Bespoke Concierge MD. I've spent over 15 years diagnosing and treating complex cases just like this. And I have ADHD. I spent years thinking I was just bad at finishing things and forgetful. If I almost missed it in myself, and I'm a doctor, imagine how many people are walking around right now with no idea. According to the CDC, 12% of children ages 3 to 17 have been diagnosed with ADHD as of 2024. Roughly 7 million kids. In adults, about 15.5 million Americans carry an ADHD diagnosis. And more than half weren't diagnosed until adulthood. They spent their childhood struggling without knowing why. And now they're managing careers, raising kids, and holding relationships together on a brain that never got the right support. But here's the part nobody talks about. The actual prevalence of ADHD hasn't really changed. What's changed is awareness. We're finding people who are missed, but we're also catching people who don't belong there. Both overdiagnosis and underdiagnosis are happening at the same time, caused by the same root issue. ADHD shares its core symptoms with a long list of other conditions. So what are those conditions? I guarantee at least one of these is going to surprise you. This is why ADHD gets misdiagnosed more than almost any other condition. Inattention, hyperactivity, and impulsivity show up in at least 10 other psychiatric conditions. And adults with ADHD have 5 times the odds of also having anxiety and nearly 9 times the odds of having bipolar disorder. So these don't just mimic ADHD, they often coexist with it. Ask yourself as I go through these, does this sound more like me than ADHD does? Anxiety disorders are the most common mimic. Can't focus, restless, can't sit still. That sounds like ADHD, but it also sounds like anxiety. In ADHD, your brain is chasing novelty. You're distracted by something more interesting. In anxiety, you're distracted by dread, worry, and racing thoughts, not boredom. And the restlessness and anxiety goes away when you're relaxed. With ADHD, it never does. Depression has a massive overlap. Poor concentration, low motivation, emotional swings. But in depression, those concentration problems are episodic. They come during depressive episodes and lift when the episode resolves. ADHD concentration problems have been there your entire life. Depression also brings anhedonia, the inability to feel pleasure, which is not a core feature of ADHD. Bipolar disorder gets confused with ADHD constantly. Impulsivity, restlessness, poor focus, both have them. But bipolar symptoms cycle. They appear during manic episodes and then fade. ADHD symptoms are constant, there since childhood. Bipolar also brings elevated mood, grandiosity, and decreased need for sleep, things ADHD doesn't cause. PTSD might be the sneakiest mimic, especially in kids. A traumatized child looks hypervigilant, distracted, irritable, unable to sit still, indistinguishable from ADHD on the surface. But trauma symptoms are tied to a specific event and come with avoidance behaviors, hypervigilance, and startle response that ADHD doesn't have. A trauma history is essential before any ADHD diagnosis, and it's often skipped. Autism spectrum disorder shares inattention and social difficulties with ADHD, but the social dysfunction is different. In ADHD, social problems come from impulsivity, interrupting, not reading the room. In autism, it's difficulty interpreting facial expressions, tone of voice, and social cues, along with restricted interests and repetitive behaviors. Substance use disorders can also mimic ADHD. The DSM-5 requires clear evidence that ADHD symptoms existed before the substance use started. If symptoms improve with sustained sobriety, that's your answer. One more thing, women are disproportionately affected. They're far more likely to get labeled with anxiety or depression first because their ADHD tends to be inattentive rather than hyperactive. This is part 1 of my ADHD series. Part 2 covers the different subtypes of ADHD. I'll link it here when it's live. Now, everything I just covered, those are psychiatric conditions. But here's what most people and a lot of doctors completely miss. Your ADHD symptoms might not be psychiatric at all. They might be coming from your blood. This is the section I really want you to pay attention to, because this is where I see the biggest gaps in care. ADHD symptoms can be caused by medical conditions that have nothing to do with your brain's attention system. If nobody ran the right lab work, you could be chasing the wrong diagnosis for years. Thyroid dysfunction is one of the most common medical mimics. An underactive thyroid causes fatigue, brain fog, and poor concentration. An overactive thyroid causes nervousness, irritability, and restlessness. Both look remarkably like ADHD. A simple TSH and free T4 blood test rules this out. Iron deficiency is huge, especially in women and children. Even without anemia, low iron causes cognitive dysfunction, irritability, and difficulty concentrating. A serum ferritin below 30 is deficient, one of the easiest things to check for and the most frequently overlooked. Vitamin B12 deficiency causes fatigue, cognitive impairment, and memory loss, all overlapping with ADHD. It's common in older adults and anyone with absorption issues. Lead toxicity is a well-established cause of attention deficits in children. Research shows lead exposure nearly doubles the odds of ADHD-like symptoms. Newer studies also point to air pollution, pesticides, and chemicals like BPA and PFAS as contributors, especially with prenatal or early childhood exposure. Then there are neurological mimics, absence seizures that look like daydreaming, post-concussion syndrome, and rare conditions like autoimmune encephalitis or Wilson's disease. So ask yourself, when you got your diagnosis, did anyone order blood work? Did anyone check your thyroid, your iron? If the answer is no, that's a problem. In my practice, Bespoke Concierge MD, this lab work is built into every ADHD evaluation we do because you can't diagnose what you haven't ruled out. Pause the video right now. Did your provider run any of these tests? If not, screenshot this list and bring it to your next appointment. Which brings us to the most important part of this entire video. If all these things can be confused with ADHD, what does getting it right actually look like? If you take one thing from this video, let it be this. A proper ADHD evaluation is not a 10-minute telehealth conversation. It's not a single questionnaire, and it's not a self-diagnosis from a TikTok video or a Google quiz. Fewer than half of the top ADHD videos on social media actually match clinical diagnostic criteria. In other words, fake news. A thorough evaluation includes a detailed clinical interview covering your current symptoms, childhood behavior, school and work history, and daily functioning. It uses standardized rating scales like the Conners or Vanderbilt to quantify symptom severity. It gathers input from people who know you, a partner, parent, or a close friend, because ADHD affects how you function around others, not just how you feel inside. It includes a medical workup, thyroid, iron, B12, and screening for sleep disorders. It must establish that symptoms started before age 12. That's a DSM-5 requirement. ADHD is neurodevelopmental. It doesn't appear for the first time at 35. And it screens for co-occurring conditions. The right answer might not be ADHD or anxiety, it might be both. Getting the full picture is the only way to build a treatment plan that works. ADHD is real, common, and treatable, but it's one of the easiest conditions in medicine to get wrong. A quick screening or social media quiz will never catch what's really going on. If anything in this video sounded like your story, if treatment isn't working or you've never been properly evaluated, you deserve real answers. At Bespoke Concierge MD, we do comprehensive ADHD evaluations the right way. We screen for co-occurring conditions and medical mimics I covered today. We run the lab work, we review your full history and build the plan specific to you. Visit bespokeconciergemd.com or tap the link in the description. If you're not sure where to start, the video on the right describes the ADHD assessment we offer. The playlist on the left covers ADHD-related topics in detail. And hit subscribe. I publish evidence-based medical content every week that could change your life. Now here's what I need you to do. If this information helped you, share this video with someone who needs it. Someone in your life is struggling with ADHD right now, feeling hopeless, blaming themselves.